Hi, I'm Elyse, an occupational therapist and certified stroke rehab specialist. And today, I'm going to answer your questions about spasticity after stroke. Question 1. What is spasticity? Well, spasticity after a stroke is when you have continuous tightness and contractions of the affected muscle. And importantly, it is velocity dependent, meaning when you move those affected muscles through their range of motion, that spasticity, that tightness is going to get worse. This happens primarily for two different reasons. There is a hyperactive spinal stretch reflex, and the brain muscle communication has a lot of interference and can't communicate effectively. So let's dive just a little bit deeper. The spinal stretch reflex typically is used as a protective mechanism. So if you are overstretching a muscle group, it says, hey, contract, contract, because we want to avoid injury from overstretching. When there's a stroke, that leads to that hyperactivity of that reflex causing contraction and tightness. Now, the second piece is that the brain muscle communication just isn't there, or that there's a lot of interference and interruption between that communication. So the brain cannot effectively tell the spinal stretch reflex, hey, you need to calm down, so that spinal stretch reflex just continues to cause those muscles to contract. Question 2. What is the difference between high muscle tone and spasticity? So these terms are often used interchangeably, but there is actually a difference. Muscle tone in general is used to describe sort of the characteristics of the muscles themselves. So when we say high tone or hypertonicity of the muscles, that means that they are stiff and tense. And you can sort of think like when you shiver, you tense up, that you're getting a high muscle tone. Hypotonicity or low muscle tone is when we see flaccid or soft muscles, and often this happens in the first few days after a stroke. When we're talking about hypertonicity or high muscle tone versus spasticity, the big difference here is something I've already mentioned. Spasticity is what we call velocity dependent, which means that when we move those affected muscles through that range of motion, you're going to see the worsening of that muscle tone, and sometimes you'll even get a catch. Question 3, when does post-stroke spasticity start? So of course, this is going to be variable person to person, but I found an interesting study that has sort of validated what I have seen anecdotally in the clinic, and it was published in the Journal of Central Nervous System Disorders. Here's what they found. Spasticity is estimated to occur in almost 25% of patients at the 2-week post-stroke mark, but after 12 months, the prevalence of spasticity increased to 38% of patients who were having their first stroke and to 44% in patients who were having a recurrent stroke. And I think this tells us something really important, which is that spasticity develops over time. You don't always have spasticity right after the stroke happens. In fact, it is more normal to see low tone or flaccidity right after the stroke happens, which is where, the arm may just be kind of hanging and limp and difficult to move. And that spasticity develops over time. So it can come as a big surprise to someone, a couple of months later when they start developing that tightness and stiffness in their affected muscles. I'm gonna leave a link to my 7 Brunstrom stages of recovery video. You may find that helpful. It walks through the different stages of muscle tone recovery, ranging from low tone to normal movement and tone. It's important to note that people will not move linearly through these stages most of the time. Sometimes they skip and hop through different stages, and sometimes people get stuck in certain stages, including being stuck with spasticity after their stroke. Question 4, will spasticity go away on its own? Well, the answer is sometimes. Sometimes it will, and sometimes it won't. If we think about the 7 Brunstrom stages of recovery, you start with low muscle tone flaccidity, you see increasing spasticity, peak spasticity, decreasing spasticity, returning eventually to normal muscle tone. Rarely, but sometimes, survivors will move through each of those stages until they return to completely normal muscle tone. However, that is more unlikely. Usually what happens is someone will get stuck in that increasing spasticity state, or even decreasing spasticity, gaining more movement, but still having some of that muscle tightness and stiffness associated with their spasticity. Question 5, is there a cure for spasticity? So currently there is no one fix-all cure for spasticity, but there are a lot of different treatments that can help to manage or reduce spasticity that you can talk with your doctor about depending on your specific situation. And they include things like taking an oral anti-spasticity medication. For more severe cases, the surgical implantation of a baclofen pump. They also include something I'm sure you've heard about, which is Botox. There is some moderate quality evidence for Botox. And I also found an interesting 2021 study that looked at using e-stim on the injected muscles where Botox was injected to actually boost the efficacy of Botox. Electrical stimulation also has some moderate quality evidence that it can help to reduce spasticity. Acupuncture with e-stim or acupuncture with massage was found to help spasticity. And there is also a newer treatment that's coming up called hyaluronidase injections that may be able to help reduce spasticity. And of course, in really severe cases, using surgery, usually in the form of a tendon release surgery, if the spasticity has gotten so bad that the tendon is starting to shorten, can be helpful to improve that range of motion. Question 6, what can I do to manage spasticity on my own? So the first thing I would say is that if it's relatively soon after your stroke, the best thing that you can do is look for signs and symptoms of spasticity. It's better to catch it on the front so that you can get treatment immediately when you start noticing that spasticity developing. However, if you are months, years out from your stroke and you need better ways to manage it now that you have chronic spasticity, a daily prolonged stretching routine has some low-level evidence. So prolonged stretching just means that you are stretching out those affected muscle groups 15, 30, 45 seconds, maybe doing a couple repetitions of those to help reduce that spasticity in the short term. It's not going to be a cure-all, it's not going to fix it over time, but it can help manage it day to day. The second thing I would say is make sure that you are positioning yourself in ways that don't contribute to increased spasticity. What does that look like in kind of everyday life? Well, we typically see this, what we call flexor synergy pattern, which is where the arm is sort of internally rotated, the elbow is bent, and everything is sort of flexed up like this. We want to avoid that position when we're trying to better manage and reduce spasticity. So if you can try to get that arm out, away from the body, to help reduce some of that spasticity, positioning is a great way to do that. And also using warmth may be able to help. So using a heating pad or a hot water bottle. Of course, if you have sensory issues, make sure that somebody else is testing that for you or that you're testing with your other hand to make sure that it's not going to be too hot. But we think, cold weather and cold can cause muscles to tighten up and stiffen and often make spasticity worse. So using warmth can help to relax those muscles just a bit, especially in preparation for stretching, in preparation for an exercise routine. It may be helpful, although it is management. It's not going to cure it, but it can help to relieve it in the short term. Question 7. What makes spasticity worse and what can I do about it? Well, there are a couple of things that make spasticity worse, and they include sneezing, yawning, heightened emotions, and cold weather. So you are not crazy if you felt like your spasticity has gotten worse when you've gone outside and it's cold. Perhaps you've been anxious, or maybe you sneezed and your arm kind of drew in really quickly. When we think about spasticity, it's contraction, it's stiffness, it's tenseness of the muscles. When we're doing each of those things, sneezing, yawning, having maybe anxiety, or we're hyper excited, or even going out in the cold, our muscles tend to tense up. So spasticity can get worse in those scenarios because we're already seeing tension and stiffness happen in the muscles. So for sneezing, yawning, and heightened emotions, you can try mindfulness. Now for sneezing and yawning, those are things that sort of happen subconsciously. So It's a little bit harder to practice mindfulness in those scenarios, but after the fact, after you've sneezed or yawned, you can kind of take a moment and say, okay, now I'm gonna try to relax my body so that spasticity doesn't hang on. And for heightened emotions, if you are feeling very anxious, very excited, you can try to take a step back if you notice your spasticity getting worse and try to use some calming techniques and say, hey, I'm overexcited or I'm anxious. I'm gonna try to relax a bit. And of course, if you're having to go out in cold weather, try to dress appropriately. Make sure that you're getting lots of layers, lots of warmth over the affected side, so that you reduce the effect of cold weather and the need to shiver or tense up. All right, everyone, that's it for today. Leave me a comment and let me know, what did you find helpful for your spasticity after stroke? And I'm gonna be leaving a link to my Spasticity After Stroke playlist, which has different workouts and stretches for spasticity, as well as a more in-depth explanation for spasticity and why it happens. If you found this video helpful, please make sure to leave it a like. And if you're new here, subscribe to the channel and click the bell to get notifications for when I post new videos. Post-Stroke is a nonprofit, and you can help us keep our content free, either by clicking in the YouTube bar below and giving us a super thanks, by donating once via PayPal, or by becoming a Patreon member, where in exchange for a monthly donation, you get access to cool perks like behind-the-scenes footage and even YouTube shoutouts, of which I have some today, as you can see here. A big special thank you to Heather G in our Empowerer tier. We can't do what we do without you all. Thank you all so much for watching. I'll see you next time.